Guys, nakikita niyo ba ako? Hindi. Guys, how it works, meron tayong mga classmates sa Zoom. Okay, meron kayong classmates from other schools. From Tinma schools, no? So,
Kasi wala ko. So, yung isang project ba? Stop mo yun. Sila tawa sa ano? Isa dyan sa ako.
sinong kumukuha? Saka yung mga gamit. I mean, meron bang staff na pwedeng ano?
Wala.
So, kami na.
Oo, dyan, maririnig ako. Sino pa lang ako? Fridays. Wednesday na lang. Ay, music po. Ano sa ko? Gawin ko yung wala dito eh. Paano mo? Kasi lang. Shooting mo hero kasi ako yung kaldo. Batang dito na. And tapos, Jerry. Sige, assist ka na lang. Nasa kapag-ipan. Tapos po ito rin siya. Baby, ah, Diyos, mga mga.
Bago po pala sir.
B.
Okay. Ako naman ako. Dalikan mo siya. Yung attendance na lang, ma'am, pala.
Wala po. Ay. Wala din ako. Yes, kung pinagawa lahat.
Guys, nakikita niya? Maliwanag? Okay. So let's start in... Guys, naririnig ako dyan? Okay. Yes. Nakikita yung slides from Zoom meeting, guys? Walang issue sa audio?
Wala po, sir.
Okay, good. Okay, so as discussed yesterday, guys, we will compute the, for the module 3, diagnostic exam, meron tayong 6 na hindi na-compute, no? So, I asked you to check or to, what you call this, to compute para malaman natin ang sagot. Then after that, we will proceed to module 4, 5, and 6. Okay? Sinong nakakuha ng module 6 exam? UI, COC, University of Pangasinan? Boom. Okay. Oh, nasaktan ka ba? I'm seeing computations. Nag-ready si Miss Mamuyak tsaka si Miss Jamie ng University of Pangasinan. So let's see if tama yung computation. No? So from SJC, sino naka-compute? Number 6. Number 5 muna. 5. Number 5. Which of the following amounts of copper sulfate is required to make 400 ml of an aqueous stock solution such that when the stock solution is diluted 50 times with water, a final solution of 0.1% weight per volume copper sulfate is produced? So, paano yan? Number 5. Sino kayo mga third years, baka may makapag-compute sa inyo. Number 5. Ano sagot? Ay, well, alam niyo yung sagot. Pero paano nakuha? Okay, from other groups sa Zoom, how did you get the answer? How did you get the answer? Anong mas malinaw, yung camera ng RGM o yung camera ko sa Zoom? Okay, camera ng RGM ang mas malinaw. So ito yung gagamitin natin. Okay. Asa na yung whiteboard? So ang sabi dito, which of the following amounts of copper sulfate is required to make 400 ml of an aqueous stock solution such that when the stock solution is diluted 50 times, okay, with water, a final solution of 0.1% weight per volume. So 0.1, so 0.1% weight per volume is equivalent to what? Diba that is also equivalent to 0.1 gram per 100 ml solution. Tama? Kaya ang sabi dito, diluted 50 times. Diba? So when the stock solution is diluted 50 times, ito daw yung mangyayari. Tama? So ano ang original? So how would you get the original solution? So you will just multiply that by 5. Diba? So 0.1% weight per volume or 0.1 gram per 100. So that will be magiging 5%. Diba? 0.1% weight per volume times 50 is equal to 5% weight per volume. So this will be 5 grams over 100 grams. 100 ml. Okay? Then, ilang grams daw kapag 400 ml? So ratio and proportion. So when 2,000 equals 100. Nakuha? Okay? So number 6. So the correct answer is 20 grams. Next. O number 6. O sino na dito? SJC. Sino na?
Martina.
Oh, ikaw na oh. Bisa mo na. From the what you call this? From the school meeting.
Number 6.
Go. So paano nakuha ang 56? Hindi mo mabubuksan yung video. Oh, explain mo. Para makilala. Kilala niyo ba siya?
Yeah. Why is Martin? So, answer your form is weight times dose. Yung weight ng divide times yung dose. Weight oral weight dose na yung body weight na. So, yung weight ko ni 5 is 8 kg times 7.
Okay, so cancellation of units. That would be 56 milligrams. Okay? So correct. Number 6, correct. Thank you. So number 7. So Miss Mamuyak and Miss Jamie, okay? Correct? So number 7, how did you get 420 ml? So the patient requires 4 the volume of an oral liquid medicine available. Di pala ka. Wait lang ha. So the volume of an oral liquid medicine available as 2 milligram drug X per 5 ml, which is required for a 14-day supply for a patient prescribed a dose of 4 milligram drug X 3 times daily. So what will be the volume? So 4 times 3. O tapos 12 times. Ilan yun? 1. Tapos paano naging 140 ml? So 2 milligram per 5 ml. Right? So which is required for a 14-day 14-day supply for a patient prescribed a dose of 4 milligram 3 times daily. Diba? So kung 4 milligrams ang kailangan niya, what will happen to this? So ilang ml? 10. Diba? 10 ml. Now, so 14 times dito, prescribe 14 day supply for a patient prescribed for 4 milligram of drug 3 times daily. So 4 times, ilan? 4 times 4 milligram times 3 times 14. So 168, tama? Tama ba? So 168. Okay, 168 milligrams. Milligram. Okay. So kung 168 tama? Sige nga paki-compute.
Eight or
168 times 5. 840. Divided by 2. Okay? Right? So, mangyayari dyan, 2 milligrams times x ml equals 168 milligrams times 5 ml. So, cancellation. Okay? Ay, sorry, mali. Di ba pala? So, XML is equal to 168 milligrams times 5 ml divided by 2 milligrams. Cancel. Okay. Correct. 420. Number 8. Number 8 is just what? C1 V1, C2 V2, right? So what's your answer in number 8? O, paano yan? The volume of alcohol, 95% volume per volume needed to produce 1.90 liter of 50%. Paano? What is the first volume? C1, V1, what's the concentration? So, ang sabi, the volume of alcohol, 95% volume per volume produces, to produce 1.90 liters of 50% volume per volume. So, ibig sabihin, yun yung kailangan natin niya, di ba? So, 1.90, sorry, 50%. Ito kasi yung desired mo, tama? Times 1.90 liters. Ano yung concentration, initial concentration? That's 95%. Okay. So ano yung X? So 50%, 0.90 liter. Sige nga pa-compute, 1,000 ba yan?
Let's start.
150 times 190. Ba't ganun? 50. Hindi eh.
Tingnan.
Ba't ganun? 95. Okay, gets. Okay, so that will be 0.95. Diba 95% weight per weight. So that means what? That means ilan? Hindi, 0.95 divided by 95. Right? So, malito. Dito.
Here.
Okay. So, 0.95. 95% equals 0. Liter. So, in ml, then, may eraser ba? Sa line. So, 0.95 times 100 pa. Okay? 0.95 para 1%. So, ilan to? 1. Diba? So, 1. 1 liter. So convert mo siya to ml. So, that is 1,000 ml. Okay? So, number 9. What volume of phenytoin suspension, 30 milligrams per 5 ml, is required to be added to a suitable diluent to obtain 150 ml suspension of 20 milligram 5 ml? Paano? Ano? Ay, hindi nyo makita yung sa board? Okay, so what's your answer here? Well, it's 100. Pero paano nakuha ang 100? Okay? Paano? What volume of phenytoin suspension, 30 milligrams per 5 ml, is required to be added to a suitable diluent to obtain 150 ml phenytoin suspension of 20 milligram per 5 ml. Okay? Paano? Sige nga, mag-compute kayo, guys. Paano? So this will just be 20 milligrams okay. So 20 milligrams per 5 ml. Paano daw ma-obtain to? 150 ml. Paano daw? So ilang milligrams dapat to? Paki-check. Ilan? 30. Okay. Tama? So what volume of phenytoin suspension, 30 milligram per 5 ml is required to be added? 30 milligram. E dito. Ilan yan? Ilan yan? Guys, ilan tong? Hindi pa, pero hindi pa to ha. Gusto ko lang i-analyze nyo kung ano yung mangyayari. Okay. Ilan? Ilang milligrams to? 150 nga ba to? I mean 30. Parang ang liit. Hindi 30 to. 150 times 20. 150 times 20 divided by 5, 600, di ba? Okay. And dito, so 150 times 30, 150 times 30 divided by 5, 900. Pero, ito yung original, di ba? Ito yung original na concentration. Paano daw magiging ganito? Okay? So, 30 milligrams over 5 ml, since parehas naman sila, equals 20 milligrams. Wait. Sorry, sabi ko. Milligrams. Okay. O, paano? So 20 ml, ang dapat na concentration daw is 20 milligram. So 20 milligram per 5 ml, di ba? So ilan daw ang idadagdag mo na diluent para maging 20 milligram per 5 ml? From dito. Paano? Paano nag-come up sa 100 ml? Tama si Miss Joanna? Miss Joanna, you're correct. Mamuyak. Paano? Correct. Correct. So that is 20 milligrams times 150 ml divided by 30. Yun lang. Okay? So, ma'am, ikaw nga, i-explain mo dito. Paano ulit?
Ano?
Ayan, sige. Kahit dyan ka na lang para marinig nila.
These are those times.
So, ano ba yung desired dose, ma'am? So, 20, okay? Tapos, okay? Times 150 ml divided by the, which is the, okay, actual to. Cancel out. Ay, 100. Okay. Number 10. Last number before we proceed. So given a 20% weight per volume solution of chlorhexidine gluconate, what volume is required to make 400 ml of a 2% weight per volume solution? Okay. Correct, Miss Jamie? This is C1B1, C2B2. So, paano nyo gagawin yan? So, di ba ito lang ay 400 times 400 ml times 2%, which is C1B1, C2B2. So, then that will be 800 divided by 20, di ba? What is the concentration? Even ka ng solution na 20%. So, yan na yung 20% mo, di ba? Dito. Okay. Tapos, what volume is required to make 400 ml? Is that yung volume mo? 2% weight per volume. Di ba? X is 40. Tama? Yes. So, mga cancel out. Di ba? Cancel out. So, that will be 2% times 400 ml. Wait. Tama? 40 ba to? 800 divided by 20. 40. Okay. Okay, so correct yung mga computations, Miss Jamie. Okay, so now let's proceed to module 4. Okay. Ano? Nasaan yan? Guys, nasaan yung...
Sabi mo, 4, maging 4 at 5.
Okay guys, we're just preparing for the module 4, okay? Ba't ayaw? Kayo, nag-exam din ba kayo? Hindi, 15 lang. Hindi kayo na,
Yes. Sir. Okay naman. Sa TV nila yung iPhone. Kasi meron na mga reactive. Kasi anak ng pinansa.
Okay, so let's start with module 4. So number 1, clinical uses of histamine except. So the correct answer is letter D. Okay, treatment of severe bronchial asthma. Okay, so except, wala pa rin sa inyo. Diba? Okay. Nasa inyo na. Sige. Guys, sa mga nasa Zoom, wait lang ha. May kinukuha lang ditong paper. Pero the correct answer for number 1 is letter D because antihistamines are contraindicated sa bronchial asthma. Kinuha na ba? Okay.
Sinabi mo, ano siya?
Kukuha lang ako water.
Bumili ba siya? Ano okay lang? Uy, masakit ka naman lang. Ayan. Sorry, perfect. Dasal ako, please. Sige na lang ako maliit na mga. Please, ayan. Ay, sige.
Okay. So number 2. Number 2, otacoids. These are otacoids except letter B, dopamine, because dopamine is a catecholamine. Okay. So more of this would be discussed to you on module 4, pharmacology 1 and 2. And if I'm not mistaken, this will be discussed. I'm not sure where, but this will be discussed by a doctor, okay, medical doctor. So, where are the amino acid precursor of serotonin? So, what are the, or actually what is the amino acid precursor of serotonin. So it's letter C. Okay? Tryptophan. So tyrosine is a precursor of catecholamine. Magbigay nga ng example ng catecholamine. Ano ang mga examples ng catecholamines? Sa mga nasa Zoom, what are the examples? Give some examples ng catecholamines. Dopamine, epinephrine, or epinephrine. Okay. So tyrosine ang precursor ng catecholamines yun. Okay? Tryptophan ang precursor ng serotonin, and histidine naman precursor ng histamine. The following agents do not exacerbate asthma attacks except for metoprolol. Okay, letter B. Okay. So metoprolol exacerbate asthma. Number 5, physiological antagonist of histamine. Letter D, epinephrine. Okay, please remember that that the physiological antagonist of histamine is epinephrine. Okay. 6, which of the following antihistamine has the most sedating effect? It's letter C, diphenhydramine. So ano dapat ang binibigay kapag nagda-drive? Say for example, nagka-allergy. Non-drowsy, diba? 7, classification of the antihistamine used to manage serotonin syndrome. Ano nga ulit ang precursor ng serotonin? Ano ang precursor ng serotonin? Tryptophan. Okay? Tryptophan. Alright, so number 7, classification ng antihistamine used to manage serotonin syndrome is letter C, dibenzocycloheptine. Okay. Correct. Si Miss Laderas, loratadine. Yung tanong ko kanina. Number 8, antihistamine with significant anticholinergic effect. It's letter A, ethanolamine. So this will be further discussed, guys, sa module 4, sa pharmacology 1, antihistamines. Okay. First line of for the management of gastroesophageal reflux disease. For GERD, it's letter B, omeprazole. Tama? Okay. Ano ang omeprazole? Anong class? Drug class? Proton pump? It's the PPI. Okay? Correct. Very good. Very good sa mga nasa Zoom. 10, which of the following is true about cimetidine? It's letter B. Okay? It inhibits the metabolism of phenobarb. Okay. Stimulation of this receptor results in the inhibition of release of 5-HT. What is 5-HT? Serotonin. Very good. So ano daw? Stimulation of this receptor results in the inhibition of the release of serotonin. It's letter C. Okay? 5-HT 1A. Okay? So yung 5-HT3 is a presynapse to induce vomiting or stimulate vomiting. 5-HT1D, peripheral blood vessels for vasoconstriction, and 5-HT4 naman for peripheral GIT for gastric. Okay. Guys, I have a question here in Manila. Paano pumuntang Gilmore? Alam niyo yun? Mula dito ka. Hindi, saan ako, May ano? Recto. Gilmore, yung trend, di ba? Dalawa yung dalawa. Ano? Oo. Bibili pa ako isa. Hindi, may bibilin lang. May bibilin lang. Kaya lang hindi ako parang hirap pumunta kasi dalawa yung dalawang laptop. Baka mamaya. Ubuhin ako. Baka kribuhan ako. Okay, next. 5-HT4 partial agonist for females with IBS with predominant constipation. What is IBS? Ano yung I? Irritable. So irritable bowel syndrome. Okay. So 5-HT4 partial agonist for females with irritable bowel syndrome with predominant constipation is letter B, tegaserol. Okay? So yung prucalopride naman, that's a 5-HT4 full agonist for IBS. Okay? Medisegride, Serguide naman is 5-HT2A, antagonist for prophylaxis ng migraine. And cisapride naman is 5-HT4 partial agonist for relief ng heartburn due to GERD. Okay? Guys, kapag kayo rin ba kasama sa Zoom sa mga susunod na reviews? Yung mga third year? Pag face-to-face lang kayo attend. Ano na? Every Sunday lang kayo. Bakit? Anong ginagawa niyo sa Sabado? Talaga? Anong subject? Ano na? Sumin? Marami? Alright. So for the fourth years, please make sure na yung Zoom or yung environment yung okay ha. Pag kayo naman yung nasa Zoom meeting. Okay? Ay, hindi. Dito pa rin kayo? Paano yung internet yun? Galit ka, sir. Tanong lang, nag-uusap lang tayo, nagdi-discussion lang tayo. I mean, of course, we need to have a good okay? Good connection. Say for example, nasa nasa Pangasinan. Na? Wala nila. Ikaw rin. Kang galit na nag-uusap lang tayo dito. Okay. Number 13. Let's move to number 13. So, matriptan is letter A. Okay, yung mga triptans, just guys. Yung mga triptans for migraine yan. So, 5-HT1B, agonist used to manage acute migraine. So yung yung letter B, yung 5-HT2A naman, agonist used to manage headache, yun yung ergotamine. Okay? And yung 5-HT3 agonist used to manage CINB, that's serotonin, setronins. Okay. Number 14, which of the following is not an effect of PGE1? Is letter A, pro-aggregant. Okay? So, yung pro-aggregant is an effect of TXA2. So, ito yung mga prostaglandins nyo, guys, ha? Kung medyo hindi kayo familiar, so yung mga PGE1s, yan yung mga prostaglandins. So, here, ang pinag-uusapan natin dito, most of the questions coming from histamines, no? Yung otacoids, tinatawag. Okay? Available as suppositories for cervical ripening. It's letter C. Dinoprostone. Okay? Also, yung dinoprost, tromethamine that induces abortion in pregnancies greater than 15 weeks. Carboprost that induces abortion in pregnancies during the second trimester. And yung misoprostol naman for induced, it's used for induced GI, NSAID-induced GI. Yes? From the Zoom meeting, any questions? Wala? Okay. So guys, dito sa for the benefit of everyone, lahat ng details or lahat ng what you call this, yung mga nira-rationalize natin, nakasulat na dito and also the answer to benefit din yung mga nasa online. Kasi minsan hindi naman din nila makita kung isusulat ko sa board, di ba? And sometimes kapag may connection issue, hindi rin nila maririnig. So, I just wrote this down so hopefully makatulong sa inyo. Ano daw? Sino nagtatanong? Nasend na? Paano nasend? Na sa akin. Hanggang 3 lang yung nasend. Oo. Hanggang 3 lang. Pero ito wala. Okay, pag uwi ko pa. Medyo. Mamaya. Pagka every after, sinesend. Okay, latanoprost. So what's the brand name? Salata. So Coverject is your alprostadil. Salacom is your latanoprost plus timolol, no? And Hemabate is your carboprost. Used to prevent NSAID-induced gastric ulcer. Diniscuss na natin kanina. Misoprostol. Okay? Mechanism of action of aspirin. So, it irreversibly inhibit your COX. Okay? Ano yung COX? What's COX? Ano? Cyclooxygenase. Okay, very good, Miss Mariel. Cyclooxygenase. Kaya di ba meron kayong naririnig na COX inhibitors or cyclooxygenase inhibitors. Okay? True for paracetamol except? So, British approved name is paracetamol. Ano dapat yan? English dapat, di ba? Hindi British. Okay. 20. Which of the following does not apply to aspirin? It's letter A, uricosuric at low doses. Okay, so uricosuric ang aspirin at high doses. Okay, and contraindicated siya sa patients with gout. And it can cause Reye syndrome, no, when given to children suffering from a viral. Ano po yun? Miss Arlene, may question? Yung nasa UI. Miss Arlene Duse, may question? Wala. Okay. 21. Which of the following is not true about meperidine? It's letter D. Okay. Causes respiratory depression in fetus. Okay. Okay, diacetylmorphine is also known as letter B, heroin. Okay. So codeine is also known as your 3-methylmorphine, and dextromethorphan is your methylated derivative of levortan. Okay. 23. This is used in combination with methadone in opioid dependence maintenance programs. It's letter B, naltrexone. Naririnig niyo ba ito, naltrexone?
Yes, sir.
#24. What is the mechanism of action of tramadol? So it's letter D. Okay, inhibit serotonin reuptake. Guys, please remember, every drug class or every drug merong mechanism of action. So please make sure that you're able, that you will study yung mga mechanism of actions, kasi syempre, mas madali kung mga drug classes, kung ano mechanism of action nitong drug class na to, and these are the examples. But sometimes merong mga mechanism of action na specific for a drug. So you just need to review and familiarize yourselves. Okay? So for example, this tramadol, this inhibits serotonin reuptake. Right? Structural analog of meperidine, it's letter B, diphenoxylate. So a gold compound administered per orum, it's letter C, auranofin. So yung gold sodium thiomalate and oro thioglucose are administered IM, by intramuscular. Features of rheumatoid arthritis except letter C, may result following a joint trauma. So that is your osteoarthritis. Letter C is osteoarthritis, not rheumatoid arthritis. Okay. Again, yung joint trauma would result or is a feature ng osteoarthritis. Okay. 28. Which of the following statements is correct about methotrexate? So methotrexate inhibits thymidylate synthase at 7.5 to 20 milligram weight. Okay. #29. What is the metabolite of sulfasalazine used to manage IBD? It's letter D, 5-amino salicylate. 30. What is the drug of choice for acute gouty attacks? It's letter letter B, colchicine. So kapag severe, what will you take kapag severe? Severe gout. From the Zoom meeting, ano? Allopurinol. Okay, very good. Okay, for severe gouts, it's allopurinol. #31. What is the first line of treatment ng chronic gout? As we've mentioned, it's letter A. The drug that inhibits xanthine oxidase, it's letter. The drug that inhibits xanthine oxidase except letter D, oxyxanthine. Okay, so ibig sabihin, it doesn't inhibit xanthine. Okay. Mechanism of action ng probenecid and sulfenpyrazone in lowering serum uric acid level, it's letter C. Inhibits reabsorption ng uric acid in the proximal tubules ng kidneys nyo. So letter A, the inhibition of formation ng microtubules, that's a mechanism of action ng colchicine. Okay? So yung inhibition migration ng inflammatory mediators to site injury, that is also colchicine and yung mga gold compounds. Ito yung mechanism of action ng colchicine and other gold compounds also. Okay? (34) Tinnitus is usually experienced when levels of salicylate reach. It's letter A, 50 to 80 milligram per deciliter. Okay? So in addition to tinnitus, you can also have hyperventilation and respiratory alkalosis. So at levels of 80 to 110 milligram per deciliter, you may have metabolic acidosis and hyperthermia. Okay? And kapag 110 to 160, pwede ka magkaroon ng bleeding. And greater than that, you may have respiratory and renal failure. These are weak organic acids except nabumetol. Okay? So aspirin, ketoprofen, and dipyrone are all weak organic acids. Okay? Any questions from the third years? Wala? Or hindi nyo maintindihan so far? Nagpikol na ba kayo? One. So, at least may nagre-ring, nagre-register na. So, which of the following statements is true about phenomenes? It's letter A. It should not be used to patients less than 14 years old. Okay.
Galing ng tayo ko. Kulay green. Yeah. 15 minutes, I have this.
Ba't na doble?
Nantok ka?
Okay.
Nantok ka?
The side effects of this drug are granulocytosis, aplastic anemia, ATN, and nephrotic syndrome. It's letter C. May phenylbutazone. So for gold compounds, ang mga side effects yan is hypersensitivity.
Nandiyan mo sobra.
Most common is hypersensitivity and nephrotic syndrome. For letter B naman, for hydroxychloroquine, the most common side effect is optic
Hindi nga ito
neuritis.
kasi tinatanggal mo sa amin.
Yes, Mr. Abdul.
Diba?
Okay. So for methotrexate, the most common side effect is hepatotoxicity. 38. This exerts a laxative effect by creating an osmotic gradient in the small and large intestines and increasing the activity of cholecystokinin pancreozyme. It's letter B. Okay, fleet phospho. So metamucil is a bulk forming laxative. Okay? Yung camponis naman, that is a stimulant laxative. Okay? Ano ba yung camponis? Ano yun? Ano? Anong buri? Anong buri? Di ba sena ang camponis? Sena? Anong buri? Okay. So dulcolax is a stimulant laxative also, okay, which is a diphenylmethane derivative. Okay? So, yung tangkunis is an anthraquinone derivative while yung dulcolax is diphenylmethane derivative. 39. This should not be used in pregnant except letter A, metamycin. Okay? So, pwedeng gamitin ang metamycin sa mga preggy. So, yung fleet phosphosoda can cause systemic effect. Tangkunis, and castor oil, bawal. Kasi pwede kayo magkaroon ng premature labor or premature, yeah. Okay? 40. Chronic use of anthraquinone derivative stimulant laxative. Ano nga ulit yung anthraquinone derivative kanina? Guys, 2 questions before. Ito, tangkunis. Okay? Okay? So the correct answer is letter A. Melanosis coli. So chronic use of bismuth subsalicylate would cause tinnitus. Okay? And chronic use ng calcium carbonate would cause milk alkali. One. What is the drug classification of docosate sodium? It's letter D, emollient laxative. So itong part ng mga questions na to, nandito na tayo sa saan? Sa mga GI drugs, di ba? Laxatives. Kaklase mo sila? Okay. Okay ka lang, Del. What is the drug classification of dulcolax? Diphenylmethane derivative stimulant. Galing Best in reading Yo. What is the drug classification of Senocot? Anthraquinone derivative. So, Senocot, Cancunis, those are, I think, Sena. Diba? I-confirm natin, Senocot. Kaya nga, di ba, Senocot? Di ba, Sen? Yeah. Same with bigger lie, di ba? Maraming ng Sena. Ano yan, Te? Ano? Oh. No, Sena yung active. Kahit Sena, alam mo yung bigger lie, 'di ba? Sena leaves, yung mga ganon. So, Cancunis, Sena leaves din 'yon. Bio 50. Sena rin ba 'yon? Oo nga, Sena. Ayan. Sena leaves, Sena pots. Yes. So maraming kumbaga brand names, 'di ba? Cancunis. 'Di ba? Senocol. So yun yung quote and quote brand name ng Sena leaves. Okay. Next. Which of the following statements is true about Lomotil? It's letter C. Prolonged use may lead to opioid dependence. So yung contains loperamide plus atropine, that's diphenoxylate plus atropine. And which has a limited access to CNS. Okay. Ano yung BBB? Blood-brain barrier. 45. Which of the following statements is true about antacids? Is letter C. Destroys coating of enteric. Okay, so increases serum levels of ciprofloxacin? No, kasi it decreases the serum level ng ciprofloxacin. And it reduces the effect of digoxin. And should be taken 2 hours before and after. Yeah. H2 blockers that should not be used in children is letter. That should not be used in children less than, is letter A, less than 12 years old of age. So mineral oil should not be used for children less than 6 years old. Okay. Enema should not be used in less than 5 years old. And phenamates should not be used in less than 14 years old or 14 years of age. Okay. It is a mucosal protectant which binds to base of ulcers and stimulates production of mucosal prostaglandins and epidermal growth factor. It's letter B. Okay, sucralfate. So alginic acid, so this reacts with sodium bicarbonate and saliva forming a viscous solution of sodium alginate. So sodium alginate is an ingredient of antacid din. Okay? (48) What is the brand name of psyllium? Letter D, metamicid. Okay. Brand name of omeprazole? Prilosec. Okay. Lansoprazole? Prevacid. Omeprazole? Okay. Yun yung problema, no? Yung tanong ko, parang yung ano nasa second question tapos makakalimutan nyo na after. Okay, carbocysteine, Loviscol. O common side effects using calcium carbonate, yung sinabi natin kanina, milk alkali sin. So darkening of tongue, common side effect ng bismuth, subsalicylate. Okay? Cathartic colon naman, my God. Cathartic colon naman, ang usual common side effect ng mga stimulant laxative. And melanosis coli, yung mga anthraquinone derivative stimulant laxative. Ano nga ulit ang anthraquinone derivative stimulant laxative? Example? Thank you. Thank you. Pharmacy notes. Yes po. Social lang. Ngayon lang naka-ano eh. Hindi ako bumibili nito sa 7-Eleven. Mahal eh. Ah? Ganun pala yun. Okay, so ano nga ulit ang example? Anthraquinone. Okay? Hancunis. Sena, okay, tama. Sena, Senocot, same. Okay, yun. 53. Which of the following does not apply to N-acetylcysteine? It's letter C. Increase the water portion of mucus to facilitate expectoration. Guys, any questions so far? Nabibilisan ba? Nabibilisan dito sa third year? O bilisan na para makauwi agad? Ano naman gusto? Ha? Dito sa Zoom, may questions? Zoom.
Wala po, sir.
Hindi ba mabilis? Hindi mabilis sa UI, sa UPANG, sa COC? Wala? Okay.
Progress.
Okay, these are controllers except letter A, albuterol. Uy, pinagchichismisan nyo dyan. Okay, these are controllers except albuterol. Okay. So first line, relievers. Okay, relievers ng COPD, it's letter A. Anticholinergic. So SABA is the first line reliever ng bronchial asthma. So yung glucocorticoids plus LABA. What is LABA? Ano ang LABA? Ano ang LABA? Long-acting beta agonist. Di pala spokesperson mo na, Paul. Spokesperson mo siya. Pagka-search mo siya yung magsasabi. Okay. So, glucocorticoids plus LABA, yan yung first line controller. Okay? Ng bronchial asthma and COPD. And glucocorticoids naman, yan yung first line treatment for allergic rhinitis. What is the mechanism of action ng dextromethorphan? Is letter A. Hyperpolarization ng cough cell. So yung letter B, yung decrease of sensitivity of peripheral cough receptors, yan yung mechanism of action ng anti-tussive nyo. Okay? Yung simulation ng gastropulmonary mucokinetic vagal reflex, that's your garbage. Bastos to eh. Ito nga kahapon, pigil na pigil pa eh. Ikaw wala kang pigil. Ha? Ha? Okay. So letter C is guaifenesin. That's the mechanism of action ng guaifenesin. And yung letter D, that's the mechanism of action ng N-acetyl cysteine. Okay? Okay. Okay guys, sa mga nasa Zoom, baka ma-misinterpret nyo. Nagkakatuwangan lang kami dito. Diba? Bubuksan ko na yung camera para alam nilang nagkakatuwaan. Okay. So yun. Number 57, rectal burning is associated with the use of glycerin. Okay. Guys, from UPANG, from other schools, ang dami kong nakikitang nag-leave ng Zoom. Any issue sa Zoom meeting?
Mahina
Meron
po
ba
yung
ano?
wifi.
Ano?
Mahina po yung wifi po.
Mahina yung wifi. Okay, kung ano, bumalik ha, balik kayo ha. Para okay. So, side effects ng lactulose is flatulence and cramping. And for sorbitol, it's also flatulence, cramping, and abdominal. 58. Which of the following is not true about mineral oil? It's letter C. Site of action are in the small intestine and large intestine. Mali yun kasi sa large intestine lang nag-a-act or yung site of action ng mineral oil. Okay? Ba't hindi kayo nag-notes? Ba't hindi kayo nag-notes? Wala lang, tanong lang yun na. Dahil hindi, wala lang. Dahil hindi kayo required. Ano? Talaga ba? Hindi, meron ba kayong ibang assignments dito? Like, required na kayong pumunta para beginner? Dahil required. Pumunta lang kayo dito pa dahil required. Pero kung hindi required, hindi naman kayo pupunta. Ayun. Pupunta pa rin pala eh. Okay. Ba't wala ka kahapon? Okay. Ano, bakit wala ka kahapon, ma'am? Ano nga name mo? Julian? Akala ko kahapon lalaki. Julia. Okay. Okay. Okay, which one? Number 59. Let's move. Number 59, which of the following statements is true? So letter B, pregnant patients may not use mineral oil for laxative purpose. Okay. So as I've mentioned earlier, castor oil, okay, induces premature labor. Kaya hindi siya kasama or hindi siya ginagamit as laxative. 60. This drug should not be given with 2 hours. Kanina rin yan. O, di ba? Ano? It's letter D. All of the above. So, Kaopectate, Valsevelam, and Pepto-Bismol should not be used or should not be given within 2 hours after administration of other drugs. Di ba? Antacids, kung maalala nyo kanina. Constipation is the most notable side effects of this compound, calcium carbonate. Ano naman kapag diarrhea? Magnesium. Ano pa yung nagkukos ng constipation? Bukod sa calcium carbonate? Aluminum. Okay, very good. So EPS adverse effects limit the prokinetic effect of this drug. Is letter C, metoclopramide. Kamusta ang scores natin diyan? Anong mas marami, yung bilog o yung Okay. Okay. Kaya ba tinapuanan? Bakit? Oo nga, parang anong-ano ka eh. Iritang-irita ka na. Ba't saan ka naiirita? Sa mga klase? Okay, 63. Which of the following drugs may be used to manage GERD in an 8-year-old patient? It's letter B, antacids and alginate. Okay.
So,
64, a mucosal protectant used to manage PUD. Ano yung PUD? Ano sabi niya? Okay, it creates a physical barrier on ulcers and erosions to promote healing. It's letter D. Okay, so sucralfate and bismuth, subsalicylate. Okay, so yun yung mga mucosal protectants natin. So for peptic ulcers, okay? Which of the following medications is least likely to cause gastric ulceration? Is letter C, rofecoxib. What effect of endogenous compounds on bronchial tone is letter C. So acetylcholine and adenosine increase bronchial tone, which causes bronchoconstriction. Okay. Ano itsura dyan sa, patingin nga ng isa. Okay. 67. Which of the following below is true about formoterol? So formoterol is primarily used as a controller and may also be used as reliever because of its fast onset of effect. Okay. Ano ang formoterol? Anong drug class? What is the drug class of formoterol? Very good. So this is long-acting beta agonist. Okay? Okay, very good, Jamie and Joanna. Ano? Wala siyang? Mamaya. Naka-schedule yan. Okay, 68. Which of the following applies to methylxanthine? It's letter C. Inhibits PDE4, resulting in higher levels of CAMP. Okay. So the one that antagonizes acetylcholine receptors is your adenosine receptor. Okay. Which of the following is true about fluticasone? It's letter B. So inhibits lipase A2. May nag-aaway ba dyan? Okay. So methylxanthines inhibit
Wala na ng mga patay gutom. Ano ba ka para kabida ka mapanatiyan yan?
mute ko. May questions ba? Sinong?
Niwe.
Ha?
Niwe. Tabi naman ang lima niyan. Niwe.
Guys, pa-mute please.
Niwe.
Hindi ko makita eh.
Nakakapta niya na.
Ito. Princess Ali, may question? Okay. All right. So again, methylxanthines inhibit PDE4 and yung zileuton naman that inhibits your 5-lipoxygenase and yung mga mast cell stabilizers cause the opening of chloride channels. Okay. So treatment using this medication should not exceed 10 days. It's letter B, prednisone. Okay. 71. Management of status asthmaticus is letter C. Intravenous methylprednisone. Okay. Antihistamine nasal spray for allergic rhinitis is letter B. Azelastine. Okay. The others are ano? Pwedeng oral, pwedeng... 73. Mesna is used as rescue therapy for which of the following drugs is letter D. Cyclophosphamide. Okay. So dito sa part na to nasa anti-cancer drugs na tayo, no? Yung mga chemotherapeutic agents. Okay. Okay, citroborum factor is used as rescue therapy for which of the following drugs is letter C. Methotrexate. 75. Vitamin B12 is used as rescue therapy for which of the following drugs is letter A. Pemotrexate. Okay. Okay, dexrazoxane is used as rescue therapy for which of the following drug is letter C. Doxorubicin. So para saan ba ang rescue therapies? Okay? Para saan ang rescue drugs? Para saan ang mga rescue drugs? So yun yung mga for quick relief, di ba? Yung mga for quick action, no, of the to mitigate yung mga symptoms. Okay? Okay? All right. Any questions so far? What is the toxic metabolite of cyclophosphamide? It's letter A. Acrylate. So SN38 is a metabolite of which precursor is letter A. Irinotecan. Nandito yan. Okay, SN38 is a non-toxic irinotecan metabolite. Okay. 79. 6-thioinosinic acid is a metabolite of which of precursor is letter A. Mercaptopurine. So again, nasa chemotherapeutic drugs tayo guys ha. Na-discuss na ba to sa inyo? Chemo drugs? FD. 5-FU is the metabolite of which precursor? What is 5-FU? Guys, what is 5-FU? Ano? Fluorouracil. Okay? Fluorouracil. Common drug for cancer. Okay? So fluorouracil is the metabolite of which precursor is letter A. Capecitabine. #82. What is the source of bleomycin? Letter A. Streptomyces verticillus. 81. This drug is indicated for hairy cell leukemia, cladribine. Okay, that's cladribine. What is the source of bleomycin? Is letter A. Streptomyces verticillus. Source of mitomycin, streptomyces cespitosus. So itong part na to, these are what? Antimicrobial drugs. No? So antimicrobial, tapos later maybe antiviral. So dinidiscuss ang, sige, kumain ka na, huwag ka na mahirap. Baka hindi mo maisugod. Okay. Okay. So ang antimicrobial drugs dinidiscuss natin sa part na to sa module 4. So I'm not sure kung mas gusto nung magle-lecture yung yung antimicrobial drugs to module 6. Kasi that makes sense, micro, di ba? Pero usually kasi ang ginagawa namin sa module 4 namin siya i-discuss para pagdating sa module 6, alam nyo na kung ano yung mga. Let's see kung ano. Yung isang topic lang naman na yun. Okay? Source of downorubicin. So streptomyces, Pioceticus. Okay? So, guys, as you know, yung mga antimicrobial drugs natin, nanggaling din siya sa mga microbes. Right? So, ayan na. Ayan na yung mga sources nila. Source of teniposide, podophyllum, peltatum. Okay? So, mechanism of action ng anastrozole, it's letter A and B. So, it inhibits conversion of testosterone to estradiol and inhibits the conversion of androstenediol to est. 87, what is the treatment for prostate cancer? It's letter B, glutamine. Tamoxifen, yan yung treatment sa breast cancer. 88. Branch of toxicology that deals with the study of adverse effects of drugs and toxic substances in human body is letter B, clinical toxicology. So management of acute diarrhea resulting from irinotecan therapy, atrophy. Antimuscarinic agent used in the management of bronchial asthma, COPD, due to bronchodilating effect. It's letter D, tiotropium. Okay. Used in the treatment of atropine overdose, that's letter A, neostigmine or pilocarpine. So neostigmine or pilocarpine, pwede yan sa mga overdose or what's called this? Yung mga nag-a-addict, for the lack of a better term. Okay. Side effect of prolonged use of ephedrine nasal drops, it's letter B. Rhinitis medicamentosa. Treatment for depolarizing neuromuscular blocker induced malignant hyperthermia, it's letter B. Kumain ka na ba? Yung energy. Okay. Drug of choice. Okay, ng management of anaphylaxis-induced hypotension and respiratory collapse is letter A, adrenaline. Guys, here's the thing for the drug of choice, Yung mga drug of choice na yan, nakikita nyo siya sa mga references, sa books, di ba, sa reviewers, sa reference, kahit saan. But in practice, this may change. Okay? So, ibig sabihin, yes, drug of choice sila theoretically, but syempre, kapag in reality, like nakita mo na yung patient, meron kang ibang makikitang makikitang mga symptoms or, na pwedeng hindi yung drug of choice yung gawin. Yun yung una yung nasa isip. Like, okay, ang drug of choice ito sa sakit na to is ito. Kaya lang, si patient ay may ganito, may ganyan, may ganyan. Pwede ba ito? So, yung mga ganong considerations. Okay, but again, theoretically, drug of choice for management of anaphylaxis-induced hypotension and respiratory collapse, adrenaline. Okay? So, anong gagamitin sa board exam? No? So, syempre, yung reference pa din. Yung mga nababasa. Okay? Adrenaline. Letter 95. Anesthetic adjunct used to avoid delirium or excitation during induction is letter B. Thiopental or other any other ultra short acting barbiturates like your thiamyl, thiamylal, methotrexate. Okay. Contraindicated in patients with history of acute intermittent porphyria rather, is letter B. Barbiturates or phenobarbital. DOC of alprazolam overdose, it's clomazine. Okay. Anticholinergic use in management of extrapyramidal symptoms is letter A, benztropine. Okay, so anticholinergics which can be used for EPS or extrapyramidal symptoms ay yung mga benztropine and trihexyphenidyl. Restricted in bipolar patients taking MAO. What is MAO? What is MAO? Monoamine oxidase. Okay, due to hypertensive crisis, it's letter C, tyramine rich. Last number, antipsychotic medications associated with decreased granulocyte count, which leads to higher risk of serious infection, is letter C, chlorpromazine. Okay, so please count the number of checks or the number of correct answers. Do you have any questions, Module 4? I know that's a lot. I know some of those may not have been discussed, but again, nandito kami para i-discuss yung mga yan. Okay? Okay, let's have a 10-minute break. CR break lang we will start at 10:18. Sharp. Sa mga nasa Zoom, we will start at 10:18 sharp. Mag-CR break muna.
Ay, Gary. Saya selalu tim. Aku ada di mana? Masih ada. Nanti kelas Iya, sampai tidak. Dengan siapa? Video pun kamu. Tidak menggunakan bidang gano, biar opportunity. Lalo na pag alam mo yung mga natin.
Okay, let's start. Nasa inyo na yung 5? 6? Wala. Kahit paper, paano yun? Okay? Okay na ba yung mga nasa Zoom? Let me just share my screen. Okay. Walang kalasa-lasa yung mga pinili. Tapos ang mahal, 100. Sa may lista. Kayo rin ba kapag hindi kayo nakapagkape, parang no? Ate ka na. Siguro ako nakaka-7. Pero walang sugar. Kahit sa akin na. Lagi akong, hindi naman lagi, pero siguro mga 3 beses ako na ospital dahil sa kape. Lagi ako nasa ER. Kasi pag pero wala eh. I mean, hindi ako nakakapag-function kung walang coffee. As in, kahit di ako kumain, okay lang. Basta may kape. Ang ganong level. Wala lang, sharing. Okay, sharing lang, guys. Okay. Okay, number 1. Yun lang, ayun. Saan na yun? Wait lang ha. Ba't tayo mag-move? Yun. Okay. 1. Which of the following will be the slowest step in tablet drug absorption? Is letter A. Tablet okay yan. Okay yan ginagawa niya. At least may ambag sa likod. Okay. Okay. So letter A, tablet disintegration to granules. Okay. Tama ba kayo dyan, number 1? Hindi na wala natin kailangan. Okay, correct. Number 1, letter A. Okay? Dosage form, aging affects the release of drug. So aging of drugs affects the drug release. So lalo na sa mga sugar-coated tablets, no, yung mga shellac-coated tablets. So experiments showed that shellac-coated tablets stored for 2 years have 60% decrease in their plasma level. However, ay di-discuss natin sa dosage forms. Some of the aging, alam niyo ba yung aging? Yun nga, yung parang alak, di ba? I-store on a time period, for example 1 to 2 years, ganyan. So some of those are really for flavors, okay? So for flavorants and yung sa taste, no? So for example, yung mga mouthwash. So ini-age yung mga mouthwash para mas maano yung flavor, mas ma-intensify yung flavor and mas maging uniform. Okay? That's the reason why aging is sometimes, helpful for some of the dosage forms. Okay? So I will be discussing module 5. Okay? That's one of my comfortable modules or topics, Manu, because again, one of the reasons is I'm an IP graduate. So most of our subjects are really for manufacturing, dosage forms, and cosmetics. So yun yung mga comfort subjects. And also sa module 5, guys, in terms of board exam, sa module 5 kayo dapat, I think, pwedeng mamuhunan in terms of scores, So you could go as high as 90 plus dito sa module. Okay. Ayun. Siyempre, hindi naman mawawala sa istorya ko. Magyayabang ako konti. Yeah. So, yung grade ko dito 93. So, sa module 5. Kaya kaya nyo rin. Okay. But you also need to focus, guys. You need to focus on module 1. Why? That's 20% of your total score. Alam niyo naman yan, di ba? May breakdown ng score. So, module 1, 20%. So, dapat doon kayo din mamuhunan like inorganic chemistry, medicinal organic chemistry, and ano pa? Gen Chem, no? So, doon kayo dapat one of your focuses dapat doon sa module 9. Kasi it's kind of challenging. Medyo mahirap siya, to be fair. And also, mataas ang percentage. Okay? So, yun yung tips. One of the tips that I can provide you sa boarding. Ano pa? Module 4. Picol. Picol, hindi naman siya ganun katangasan pero medyo mahirap. Maybe because syempre depende sa tao kung hindi mo talaga trip yung subject. Diba? Medyo mahihirapan ka. But kailangan mong aralin kasi kasama siya sa board exam. Okay? And that's the focus of pharmacy. Diba? Picol. Right? Ulit. Dispensing. Kasama siya sa module 3. So, ang ano naman is per module, ang percentage, hindi per subject. So, for the module 3, that includes hospital pharmacy, clinical practice or clinical pharmacy, which includes nga yun, dispensing. So, per module kasi yung percentage. PharmCal, di ba? Module 3 din yan. So, lahat ng modules nyo, it comprises of different subjects, di ba? Kaya medyo mag-focus kayo, mag-practice ng mag-compute and mag-aral na as early as now. You know, we have all requirements, lalo na third year. Yung mga third year, syempre mag-fourth year pa lang kayo, you still have a lot of subjects, a lot of requirements, thesis, or kung ano man. But make it a point na you still study kahit ilang oras lang per day dun sa mga reviews. Okay? Yun naman yun. Okay. Kasi kahit anong mangyari, kailangan yung ma-review. Kailangan yung ma-refresh. And also, minsan nga sa review nyo pa malalaman na hindi nyo na-take ng mga basic concepts. Right? So, doon tayo mag-focus. And we are here. We are here to help you guys. Okay? Okay, number 3. Which form of the drug has the highest bioavailability? Of course, solutions. No? So, ito, sinulat ko na dyan yung decreasing bioavailability. So solutions has the highest bioavailability, followed by emulsions, then suspensions. So yung tatlong yun, liquid dosage forms, right? Then capsules, tablets, coated tablets, enteric coated tablets, sustained release product. Okay. Why emulsion dosage form for lipophilic drugs prove better? Because it's letter C. Presented a large surface area of oil to the GIT for the absorption of the drug. So ano nga ang main site of drug absorption? Main site. The GIT. Small. Guys, it's small intestine. Okay? Okay. Yung kanina lang yun, baka nalito lang kayo. Mineral oil sa large intestine. Okay. Ano daw? Ano daw? Wala? Okay, which is the major rate limiting step in the absorption of a drug from suspension dosage form? It's letter C, fine particles dissolution. So the step of drug dissolution is generally rapid due to the large surface area of the particles. Okay, so ang mga factors which are essential or yung mga common in drug dissolution form ay suspension, particle size, polymorphism, and wettability. One good thing about Module 5, guys, dosage forms, drug manufacturing, in terms of references, isa lang din naman yan. Hindi naman magbabago yan. Lagi. Unlike, you know, sa Bicol, di ba, may mga drugs tayong bago, may mga mechanism of actions na bago, update. So dito, lahat ng computations nyo, yung mga formula, it's basically the same. It won't change. Like, for example, gas laws. Diba? Hindi naman nagbabago yung formula dun. So, kailangan lang natin siyang practicein. Kailangan nyo lang siyang aralin. Right? And also yung mindset. You need to, what you call this? Parang kailangan nyo nang ayusin yung mindset nyo as early as na whatever happens, you will take the board exam. Well, number one, you still need to graduate muna before taking the board exam. Okay? And all distractions, there will be distractions along the way. But of course, through your correct mindset, malalampasan nyo yun. So, marami kayong pagdadaanan na mahirap. Pero kapag pumasa na kayo ng board exam, paano ba? Kapag pumasa kayo ng board exam, masaya. Masaya sa unang araw. Pero the next days, wala na. Pharmacist na kayo eh. Diba? So the next days would be planning kung anong gagawin nyo sa buhay nyo. Di ba? Magtatrabaho, mag-aaral, it's up to you. Pero yung saya as a pharmacist, parang one day marirecollect mo kung gaano kahirap, no? Yung pag-aaral. And some of my classmates, like, ano ba yan? 5 taon tayo nag-aaral, 6 na taon, yun lang pala yung exam. Parang gano'n. So, yung mga ano pa, some of my classmates would tell like, bumagsak pa ako dun sa subject na wala naman sa exam. Yung mga gano'n. So, yun. I mean, na-realize namin yun through the course of time. Like, matanda na kami. Parang, okay, pharmacist tayo. Tatapos tayo sa exam. Pero, at the end of the day, yung hirap na dinaanan, parang ang sarap, di ba? Ang sarap pag naiisip mo yun kung ano yung pinagdaanan yung before achieving the success. So, wala. Hindi naman ako motivational speaker, pero that's based on my experience. Yes. Hindi naman ako si Ren doon. So, joke lang. Okay, number 6. Which coating is stain and dissolve rapidly? It's film coating. Okay? Kasi bakit hindi sugar coating? Mas maraming process, mas maraming nilalagay kapag sugar coating. And kung mas maraming nilalagay sa sugar coating, what would you refer sa tablet weight niya? Mas mabigat o mas magaan? Sa film coating. Maraming ang nilalagay sa sugar. So, mas mabigat. Mas mabigat ang tablet weight na sugar-coated tablets compared sa film-coated tablets. Okay? So, bakit ba tayo nagkakaroon ng sugar coating? Ba't kayo nagko-coat ng tablets? What's the primary reason? Ano? Bakit? Number 1, taste. To mask the unwanted taste, right? Like, for example, ascorbic acid. Yung plain tablet, pag ininom mo, anong lasa? Ang asin. Ang asim, ang pakla, di ba? So, kapag naglagay kayo ng sugar or kinote yung sugar, like your potency, matamis na siya. Right? Pero, in terms of price? Yung nabibili yung 50 centavos na ascorbic acid versus potency, mas mahal. Kasi nga, mas marami kayong process, mas maraming materials na nilagay doon sa sugar-coated. Okay? So, number 2, protection. So, doon lang din tayo pumunta muna tayo sa ascorbic acid. Ascorbic acid can be easily oxidized, right? From white, nagiging anong kulay? Yellow, brown, di ba? Because of oxidation. Pero dahil kinote mo siya, nape-prevent natin yung oxidation. Okay? And also, aesthetic. Di ba? So, gusto nyo bang uminom ng mandilaw-nilaw at batik-batik na ascorbic acid? Siyempre, hindi. Pero kung wala ka nang magawa, inumin mo pa rin. Ayan lang naman yung mga common kung bakit kayo nag-sugarcoat. And we'll discuss further, no? When we get there. Which option describes the function of enteric coated tablets or drug? It's letter B. Thin dissolves completely. Okay, so the enteric coated tablet only dissolves in the alkaline environment of the intestine and may take 2 to 4 hours the enteric coated to empty from the stomach to the intestine. So ano ba ang purpose ng enteric coated tablet? So the purpose is to what? Hindi siya ma-disintegrate sa tiyan. Yes. Kasi most of the drugs na hindi enteric coated, nadi-disintegrate na sa tiyan because of the acidity sa tiyan, di ba? So, itong mga coated tablets na to, kailangan niyang lumampas sa tiyan para nang maayos or nang hindi nagbe-break para mapunta siya saan? Sa Correct. Sa intestine, sa site of absorption, which is mostly sa small intestine. Okay? So that's the reason why nagkakaroon kayo ng enteric coated patents to prevent it from disintegrating sa stomach. Naintindihan? Sa Zoom, naintindihan ba? Zoom meeting? Okay. If you have questions, please let me know, okay? Number 8, hydrophobic drug with fine particle size in capsule results in decreasing porosity of bowel bed is true. Okay. Viscous fluids and oils are administered in hard gelatin capsules. True or false? False. Okay, saan siya? Yung mga viscous fluids and oils sa soft elastic capsules or soft gel. From the below options, which will be the most widely used form of dosage form? Tablets. Letter C. Which drugs get absorbed in the stomach mostly? Acidic. Kasi your stomach is anong acid? Your stomach is acidic. Okay? So it contains or it releases hydrochloric acid. Which drug get mostly absorbed from the mouth? So number 1, the acidic drugs and lipophilic drugs. Because the pH of mouth is 6.8. Kung 6.8 yan, ano yan? Slight, ang tawag dito? Strong. Ano? Weak. Weak acid. Weakly acidic yung mouth nyo, yung pH ng mouth nyo, no? From the surface of the villi protrude smaller projections known as microvilli. Letter A. Okay. Which one of the following is not a characteristic for the small intestine? It's letter D. pH 4 to 9. 7.5. So weakly acidic to basic. To weakly basic. Okay. What is gastric emptying rate? So it's letter C. So that's the speed at which the stomach contents empty into the intestine. Okay? So ano ba yung gastric emptying? What is gastric emptying? From the Zoom, what is gastric emptying? Nako. Ano? Ano? Ano yan? Guys, from the Zoom meeting, what is gastric emptying? Ano? Sige na, basahin niyo na, guys. Okay, that's one. Pero in simplest terms, ano yun? In simple terms. Pwede. Gastric emptying. So that is the rate with the which the contents of stomach empty to the intestine. Okay? So ano yung mga ways on how to enhance or increase yung gastric emptying? Di ba? Yung lying to the left. Diba? Okay. 16. How can we study the gastric emptying for a given drug? So it's letter C. Tagging the drug with a radioisotope and scanning the stomach. Okay? So anong ginagamit natin usually dyan? So sabi dito, in vivo gastric emptying of a drug can be studied by using radiopaque contrast material. So like your bariosulfate. Okay? So this will also be discussed sa module 1, lalo na sa inorganic chemistry. Okay? Barium-sulfate. Girl, huwag na kayo magpaalam, girl. Pwede kayong lumabas. Pero, pwede ko kayo dun lumabas. Okay, pwede. Okay. Hindi ka kasi pumasok kahapon. Okay. Okay. 17. What is the main role of large intestine? So that is for the absorption of water and electrolytes. Okay? So yung environment ng large intestine nyo is mostly neutral and alkaline. Diba? And ang main role niya is for the absorption ng water, electrolytes, but cannot absorb glucose, amino acids, lipids, and other macromolecules. The liver is the major site of drug metabolism. True or false? True. In infants, the gastric pH is quite low. True or false? False. Okay, the gastric pH of infants is high. The passage from the stomach to the small intestine is called gastric emptying. And a passage from the stomach to the small intestine is gastric emptying. Is true. Okay? Okay, any questions so far from the Zoom meeting dito? May tanong? May tanong? Of the following oral liquid formulations which would be considered as an oropharyngeal formulation? Mouthwash. Okay. Which of the following formulations would not be applicable to ocular administration? Letter B, liniment. Try nyo. Diba? So, liniment hindi siya. Bakit? Kasi usually yung mga liniments ay mentholated and it would cause irritation sa mga mata. Okay. Pero kung explorer kayo, pwede nyo try. Okay, a tablet to treat a headache must first be dissolved in water before swallowing. Which of the following best describes this type of tablet? Effervescent. So anong nire-release ng effervescent tablets? Ano ang nire-release? Carbon dioxide. Kaya nga siya effervescent. Di ba? Effervescence is carbon dioxide. Right? Capsules normally fall into two main categories, which are they? So A, hard gelatin and soft gelatin capsules. May question ako, ang school ba na to ay Catholic school din? Hindi naman. Intravenous, intramuscular, and subcutaneous are all examples of which route of administration? B, parenteral. I-discuss din natin to sa dosage forms. Okay. Where is the site of administration for a dosage form that uses transdermal delivery? Wow, alam mo. Big lip. Okay, skin. Pero ano siya? What ano siya? Local effect or systemic effect? Kapag transdermal. Systemic effect. Okay. So kapag transdermal guys, tatandaan nyo ito sa systemic for systemic effect. Okay? Which of the following dosage forms deliver the API to GI tract? Rectal. Okay. Dali, di ba? 28. Name two different types of inhaler. So you have the DPI and MDI. What is DPI? So that's the dry powder inhalers. And MDI yung mga metered dose inhalers. Okay. Nasal administration is commonly used for the relief of letter D, congestion. Pag nagkamali pa kayo dito, ewan ko na. Ocular administration involves the treatment of which area? Eyes. Hindi ba kayo nasisikipan dyan? Okay lang kayo? Maganda tong room na to, mas malamig compared kahapon. Kaya lang, parang ang nahihirapan kayo. Hindi naman. Sanay. Hindi guys, seryoso ang swerte nyo sa mga classrooms yun. Lamig. Alam mo yung makakapag-jacket ka ng gusto mo. Sa mga room namin dun, Diyos ko, halos mag-t-shirt ka na sa init. Di ba naka-uniform kami I mean, tayong lahat, di ba, naka-uniform. Tapos meron kang sando or white t-shirt. Tapos sobrang init. Diyos ko, gusto mo na mag-ubarin yung uniform. Ha? Sa UP. Ay, hindi pala ako naglalala. Ako si Jeff. Okay. So, graduate ako ng UP Manila 2014. Okay. So, BS Industrial Pharmacy yung course ko. Pero nag-work ako ngayon sa pharmacovigilance, sa Clinical Research Organization. Ha? Ano? Ano? Okay. 31. The effectiveness of a drug is assessed in humans for first time during phase 3. Ano yung una? Ano yung phase 1? Safety. Very good. Which one of the following is not a physical property of drug substance being evaluated during pre-formulation studies? Is letter B, degradation. Excipients are added to tablet dosage form to improve processability. An ideal excipient should have all the properties except physiologically active kasi dapat inactive or inert. No? Yung excipients nyo. Tama? Okay. A pharmacy is developing an immediate release tablet dosage form for a new chemical entity for a treatment of acute pain. Pharmacy O is highly insoluble in water, which is say with BCS class 2. And proposed dose is 10 mg every 4 hours. If you're asked to design an immediate release tablets of Pharmacy O, which excipient combination from the following choices you will propose? It's letter C. Okay, you have lactose, polysorbate 20, cross-carmylosodium, colloidal silicon dioxide, and mag-steer. Okay? Just to provide yung immediate release action ng tap. Yan sinasabi ko. Di ba ang hirap? Okay. Generally, what is the upper limit of alcohol content in elixirs? 40%. Modified release dosage forms have all of the following advantages except letter C, the increased difference between peak and trough of plasma level of the drug. Okay. Okay, number 37. Which one of the following dosage forms will provide faster disintegration time? It's letter A. Okay. Bakit A? Bakit hindi soft gelatin capsule? Bakit hard gelatin capsule ang mas mabilis ma-disintegrate? But, before that, because guys, hard gelatin capsules contain more moisture content compared sa soft gelatin capsule. Mas mataas ang water content or moisture content ng hard gelatin capsule compared sa soft gelatin capsule. That's why mas mabilis siyang ma-disintegrate. Tama? Ayun. That's the reason. Okay? Pero tama ba kayo dyan? Mali? Yun pa lang yung mali mo, ano? Julian? Natutuwa ba kayong kasama si Julian? Feeling ko nasa stage na kayo nang naiirip na kayo. Okay. Okay, 38. Which of the following is a type of oral dosage form? This go, guys. Ayan na. Sinubo na sa inyo. Okay, correct answer is tablet. Which of the following is a type of inhalation? Nebulized. What do you mean by ophthalmic dosage form? Okay, nice. Siguro naman may 3 points na kayo dyan. Okay, regarding weakly acidic drug molecules, which of the following statements are true? Both A and B. So the solubility of weak acid increases as pH is increased. Okay? So the solubility ng weak acid in pharmaceutical formulation may be affected by the presence of your counter ions. Okay. Regarding weakly basic drug molecules, which of the following statements are true? It's letter A. Ito yung tatandaan nyo ha. The solubility of weak bases increases as pH is decreased. So habang nagiging acidic. Tama? So parang yung kanina sa 41. Solubility of weak acid increases as the pH increases. So mas nagiging pag yung pH mas nagiging basis. Okay? So counter, di ba? 43. Regarding buffers for pharmaceutical solutions for oral administration, which of the following statement is false? It's letter B. Buffers are required solely to control the stability of therapeutic agents. 44. Regarding the use of antioxidants in the pharmaceutical solution for oral administration, which of the following statements is true? So para saan ang antioxidants? So antioxidants reduce the rate of oxidation. Di ba? For the therapeutic agent. So kapag antioxidant ka, ano kang klaseng material or compound? Are you an oxidizing agent or reducing agent? Ano? Ano, Ronnie? Tama, reducing agent, di ba? Kung antioxidant kayo, reducing agent kayo. Tama? Kasi anti-oxidation. 45, regarding the use of co-solvent for the formulation of pharmaceutical solution for oral administration, which of the following statement is true? It's letter D. Co-solvents may affect the viscosity of the solution. So alcohol is the most common. Alcohol are commonly used as co-solvent in your pharmaceutical solution. Anong mga na-check out nyo ng 7-7? Parating na ba? Wala. Anong mga chinek out nyo mga third year sa 7-7? Wala. Pambayad sa dorm? Magkano na dorm dito sa Manila area? 12? Isang tao? 24? 4 per person. Mas mura. No, I mean, hindi sa amin kasi parang 2.5 eh. Time namin. Nagtaas. So madalas kayong dito sa SM San Lazaro? Saan mall malapit dito? Anong mall? SM San Lazaro. Madalas kami dun sa Avida. Avida Tower, San Lazaro. Ha? Doon sa may SM San Lazaro. Tower 5, Avida. Ano yan? Ano yan? Padis? Mahirap sa ganun eh. Like, siguro hindi ko na-trip. Kasi, well, dati talagang nung college, yung mga may energy pa kayo. Try nyo. Wala nang masama sa pag-try. Pero hindi ko talaga trip yung may ingay. Yung mga sobrang ako coffee shop. Coffee shop. Okay na ako doon. Pero nung college, syempre hindi. Bahay ka lang, wala kang pera eh. Tapos mag-Starbucks ka. Wala. Pero ngayon, pag halimbawa mga gusto magpahinga, coffee shop lang, okay na.
Pero ayaw mo daw sa facial. Wala ko sinasabi sir.
Hindi. Okay. Mamaya ulit yung kwento. Tapusin muna natin to kahit maka-50 man lang. Okay. Regarding the use of preservatives in pharmaceutical solutions for oral administration. So preservatives are required in all pharmaceutical solutions. Bakit? Okay, correct. To preserve. Para ma-maintain yung integrity ng product nyo, right? And mostly, lalo na kasi yung mga products nyo, lalo na kung liquid, di ba? Kung liquid, mas mabilis masira at prone sa contamination because of the water content. Right? Kaya kailangan nyo na. Okay. Regarding pharmaceutical elixirs, ano dyan ang tama? It's letter B. Elixirs generally require the addition of sweetening agent because mataas ang content ng alcohol nito and hindi siya correct. Not pleasant. 48. Linctus. So linctus formulation may contain high concentration of sucrose. So that is the true state. Okay. 49. Regarding oral syrups, which of the following statements are true? So in certain syrups, the concentration of sucrose may be less than or equal to 80% weight per weight. Actually, ang syrup NF nasa 85% weight per weight. Okay? 50. Regarding the stability of pharmaceutical suspensions designed for oral administration, which of the following statement is false? None of the above. Kasi lahat. Okay? So please be careful dun sa mga questions na yun, yung mga double negative. So which is not an anti, diba? So which of the following statements is false? Which of the following statement is or not true? Yun. All of the statements are true except, so mag-ingat kayo sa mga ganong traps. Okay? Mga ganong questions. So from the Zoom, any questions from 1 to 50? Sa inyo dito, 1 to 50. Sino naka 51 na? Ikaw, Julian. 49. Nagkamali ka sa isa, no? Dalawa. Sa Zoom, may questions ba o wala na akong kausap? Ilan na lang sila? Hindi, marami pa naman sila dito, pero ayun. Jamie tsaka si Joanne, magkaklase ba kayo? Jamie and Joanne from University of Pangasinan, magkaklase ba kayo? Hindi. Yung totoo, ba't ayaw nyo magsalita? Oy, ba't sa chat hindi naman tayo textmates?
Sir, hindi po.
Magkaano kayo?
Sir, magkaklase lang po sa review po.
Ha? Talaga? Pero parehas kayong University of Pangasinan.
Opo, sir. Bale po sila Jamie po kasi, sir, 4th year regular po. Tapos kami pong, yung iba po, 4th year ireg.
Ah, okay. I see. Okay, so see you when I see you sa Pangasinan.
Thank you, sir. See you po.
Okay, 51. Regarding the rate of sedimentation of pharmaceutical suspensions designed for oral administration, which of the following statements is false? Letter B. Okay. Letter B. The rate of sedimentation is increased as the viscosity of the continuous space is increased. Okay. Meron pa bang mga representatives from Iloilo? May mga students pa from Iloilo dito? Hello, Alex. Hello. Sa Cagayan de Oro, meron? Cagayan de Oro. Nandito yung mga pinsan nyo from SJ. Hi now. O yung mga pinsan nyo sa SJC, nag-hi sa inyo. Okay. Okay. O, tama na. 52 na. 52. Regarding electrical double layer, which of the following statements is true? So it's letter C. So manipulation ng zeta potential may be used to enhance the physical stability ng suspension. Okay. Tama kayo dito, 50. Magaling. Okay. Regarding the roles of surfactants in pharmaceutical suspensions for oral administration, which of the following statements is false? So alin daw dyan ang mali? Surfactants decrease water contact angle of dispersed drug particles. Tama naman yan, di ba? Surfactants promote flocculation. Tama din. So, none of the above. Okay? Letter D. Regarding the use of hydrophilic polymers for the stabilization of pharmaceutical suspensions for oral administration, which of the following statements is true? Letter D. Pharmaceutical suspensions may inhibit thixotropy. Ano ibig sabihin ng thixotropy? This is about gels, di ba? So ano ibig sabihin ng thixotropy? Kapag inagitate mo, anong nangyayari? Inagitate. Thixotropic products. Anong mangyayari? So upon shaking, nagiging liquid siya. Right? Pwede, yes. So kapag nag-stand still siya, masosolidify siya. Like, the structure of a gel. Okay? So when shaken, nagiging liquid. Upon standing, becomes solid. Okay? Hindi naman yung solid na solid ha, yung solid structure. Okay, parang gel, di ba? So yun. 55. Kikita kita, Ronnie. Nakikita akong nagkik sa iyong katawan. Ganyan ba? Ganyan ba dapat, Ronnie? Okay. Flocculated suspensions exhibit the following properties except letter A. Allow sedimentation. Okay, so yung flocculated suspensions have high degree of flocculation because of flocculating agents. A high rate of sedimentation. Okay, kasi bumababa. Tama ba? Ang suspension, di ba meron kayong yung particles nyo di ba nasa suspension lang yung particles. And through time, kapag naka-still siya, bumababa siya. Right? So yun. So homogeneity of drug concentration per unit dose. That's why kapag doon sa mga labels, this contains say 500 milligram or 500 milligram of this antibiotic per 5 ml. Diba? Okay? Concerning the manufacture of pharmaceutical suspension designed for oral administration, which of the following statements is true? It's letter C. High-speed mixing of concentrated suspensions may result in dilatant flow. So yung mga dilatant flow, i-discuss natin yan sa PFAR. Newtonian and non-Newtonians, plastics, pseudoplastics, Module 5, Physical Pharmacy. Na-discuss na ba yan sa 4th year? Physical Pharmacy. Wow. 2nd year. Nag-farm ka? Parang di mo alam. Nag-farm na ba kayo? Ba't parang hindi siya aware? Nag-farm ka naman ha? 2nd year. Nagtano? Okay. Concerning the use of pharmaceutical suspension, yes, Joanne.
Sir, pwede pong pakibalik po sa number 56 na walan po kami ng internet connection sa Pangasinan po. Thank you po.
Okay na,
Okay na
Joanne,
po.
nakikita. Okay.
Yes, sir. Okay na po. Thank you po.
57. Concerning the use of pharmaceutical suspensions designed for oral administration, which of the following statement is true? So letter A. So suspensions for oral administration are primarily used for administration to children or to elderly. Okay. So many antacid formulations are suspensions, and also ano pa? Aside from antacid, ano? Correct. Antibiotic. Okay. Concerning pharmaceutical suspensions for oral administration, which of the following statements is false? Statement is false.
Yes.
Letter D, the particle size of the dispersed drug in pharmaceutical suspension designed for oral administration must be less than 10 microns. Okay. 59. Which of the following statements is true or are true regarding stability of pharmaceutical emulsions? So emulsions are inherently pharmaceutical and stable. True. Tama naman. Diba? So ano ba ang emulsions? Diba? Combination of two immiscible liquids, right? So the stability of pharmaceutical emulsions is affected by the size of the dispersed phase. Tama rin. And the stability of the pharmaceutical suspensions is affected by the concentration of the dispersed phase, which is tama rin, right? Which of the following statements is true regarding the rate of creaming of pharmaceutical emulsions? It's letter C. Okay. The rate of creaming is affected by the concentration and type of incorporated surfactant. So again, sa pag-discuss natin dito, you will know yung process on, well, you will review yung mga process on how to make emulsions, ano yung mga kailangan for emulsions, for suspensions, no? Yung mga ingredients. Okay? Which of the following statements is true regarding emulsions? It's letter C. Oil in water emulsions are stable following dilution with water. Why? Because ang continuous phase mo sa oil in water emulsion ay water. Okay? Okay. Any questions? Wala? Pwede ka maging spokesperson na ano yun. Okay. Which of the following statements are true regarding the role of surfactants in the formulation of emulsion? It's letter B. Okay, so elastic properties of the surfactant layer at the interface between the internal and external phases are important in the stabilization. Actually, yung letter C, dapat kasama pa yan sa B. Okay? So wala talagang letter E. It's just, anyway, correct answer is letter B. Which of the following statements is false regarding the role of absorbed particles in stabilization of pharmaceutical emulsion? So it's letter A. What is the difference between adsorption and absorption? Absorption and adsorption. So absorption, it passes through, right? So na-absorb natin. Adsorption is in the surface lang. Ngayon ang difference. Which of the following statements are true regarding the use of hydrophilic polymers for the stabilization of pharmaceutical emulsions? So it's letter D. Pharmaceutical emulsions may exhibit thixotropy. Okay. Any questions? 65. Guys, may tanong ako. Anong age group lang? Yung range natin dito sa inyo. Age group lang. 21 to 20 to 24. Bata pa talaga kayo, no? Parang mga 10 taon yung age gap natin. Sa'yo. Kung ikaw ang reference, siguro mga 8 taon. De, pero kung 32 na kasi ako. Yeah. Grabe. Kung 10 years old na kayo, na ako, baby pa lang kayo. Grabe, no? Ang bilis ng panahon. Okay. Ba't 24 ka nga? Niloloko. Bakit? Ano nangyari? Ba't hindi mo sila kaedad? Which of the following statements is false regarding the preservation of pharmaceutical suspensions for oral administration? Is letter B. Okay? So preservative efficacy may be reduced by partitioning of the preservative from oil phase to the water phase of oral in oil emulsion. So guys, the questions are really long, pero yun lang din naman yung sagot. Sabihin, hindi naman kayo mahihirapan sa mga. Huwag niyong gagawin yun. Yan yung ano ko ng college, yung mga pinakamagandang pakinggan. Kasi yung mga pinakamahaba din. Kasi niisip ko, ba't naman mag-e-effort pang isulat ng ganito? I-type to ng ganito kahapon kung hindi yun yung sagot. Apparently, hindi pala ganun. Sinadya. So, okay. Which of the following statements are true concerning the physical properties of emulsion? It's letter D. The particle size distribution ng internal phase may be reduced post-manufacture using colloid mill. So, pag milling, colloid mill, anong ginagawa ng colloid mill? Para saan ang mga mills? What is milling in the first place? So that is used to reduce the size of the particles, right? Okay. Concerning the use of oil in water emulsions, which of the following statements are true? So oil in water emulsions cannot be used for the oral administration of therapeutic agents. Siyempre, mali yun. Diba? Pwede naman kasi. Oil in water emulsions may be formulated for topical administration. Tama naman, di ba? Most of the emulsion. Drugs with high aqueous solubility are frequently formulated as oil in water emulsion. Mali. Kasi dapat water in oil. Oil in water emulsions designed for oral administration must be colored. Hindi rin naman. So okay lang kahit hindi. So 68, concerning the formulation of pharmaceutical emulsions, which of the following statements are true? So all of the above. So all of those statements are correct. Okay. 69, with respect to the pharmaceutical gels, which of the following are true? It's letter D. Okay. They may contain surface active agents to enhance the solubility of the therapeutic agents. Okay. 70, with respect to ointments, ano daw dyan ang true? So the bases of hydrocarbon ointments are typically derived from petroleum. Correct. Tama naman, di ba? Hydrophobic ointment bases are unsuitable for exuding lesions. Tama din. Di ba? An ointment may be formed by fusion of silicone and oil and a wax. It's also correct. Okay? Miss Alessandra Gale, okay ka lang? Nakabukas yata yung camera mo. Okay. 71. Ay. Walang 72. 71. 70, 71, same. Okay, guys, merong ganyan sa board exam. The reason why merong akong inuulit na question. Syempre, kung hindi nyo alam yung sagot sa unang question, anong gagawin nyo sa pangalawa? Lalo na kung naulit. Isusugal nyo ba? O ipipip-tipip? Yun, yung mga ganon. May mga ganon talaga. Okay? So 71, it's D. 72. Tama to, 72 dapat to, no? May ano yung 72? Hindi ko yata na ilagay. Pabasa nga. So concerning pharmaceutical ointments, which is false. Thank you. Teka, check. Okay, 72. Concerning, wala dito sa slide yung 72 ha. Concerning pharmaceutical ointments, which of the following is false? It's letter D. Drugs that are prone to hydrolysis should not be formulated to ointment. Okay? That is false. 73. Concerning ointments, which of the following is true? It's letter C. Hydrocarbon ointments are mixtures of C30 to C50. So, ibig sabihin, long chain. Diba? Of hydrocarbons and C16 and C30 hydrocarbons. Okay? So, cosmetically, yung mga ointments natin ay unsatisfactory. Hindi siya masyadong ginagamit because of its spacyness. No? And it's also easy. It's really difficult to be removed. Okay? With respect to the paste formulation, which of the following are true? Letter C. Okay? Pastes contain high drug loading. No? So pastes are opaque and therefore can be used as sunblock formulations. But now, ano na yung mga formulation ng sunblocks yun? Parang watery na siya, di ba? Okay? Kasi may mga sunblock kapag nilagay mo, parang puputi ka din eh. Di ba? May ano? Ano yan? Oo, mga ganun. Yung misis ko talagang, Diyos ko, lahat na yata ng, ewan ko ba? Lahat ng sunblock nilagay na. Ayun. Pero ingat din kayo sa mga ganun. Though sinasabi nila na syempre dapat non-toxic or hindi siya hindi siya makaka-affect sa skin. But sometimes there are really ingredients, no? Na talaga hindi nyo alam na doon nyo palang malalaman na may issue or merong effect sa skin. Okay. 75. With respect to pharmaceutical lotions, which of the following are true or are true? So the correct answer is C. Lotions are principally aqueous formulation. Okay. So, syempre, ginagamit natin lotion for local conditions. Liniments, which of the following is true? So, pharmaceutical lotions may be rubefacient. Ano ibig sabihin ng rubefacient? Rubefacient. Sa mga nasa Zoom, ano ibig sabihin ng rubefacient? Pinapahid sa skin. Ano pinapahid sa skin, Joanna? Rubefacient. Okay. Okay. Nagkaroon ng redness sa skin. Hindi, tama yung pinapahid sa skin. So, it's more of the tawag dito, it's more of the how you administer or how you administer yung lotion, no? Through rubbing. Okay. Redness of skin. Okay? Hindi naman siya mahapde, Jamie. More of magkakaroon ka lang ng redness, no, sa skin, no? So rubefacient eye agent that reddens the skin and causes local effect, okay? Due to vasodilation. Kaya ka nagkakaroon ng redness. Hindi siya mahapde. Okay? 77. Following statements is false concerning type 1 pharmaceutical gels. Ano daw yung mali dito? So type 1 gels are easily dispensed from an ointment tube, which is relief. (78) Which of the following statements is false concerning type 2 pharmaceutical gel? So type 2 gels may only be formulated using water as vehicle, which is false. Kasi meron din tayong mga other vehicles or co-solvents or any type aside from water like alcohol. Okay. With regards, which of the following is false regarding parenteral formulations? Is letter C. Okay. 80. Intravenous route of parenteral administration. Alin daw dyan ang tama? So intravenous administration results in a rapid onset of drug action. Ano ang absorption rate nito? 100%. Okay? Which of the following is false regarding intramuscular route? Alin daw dyan ang mali? So large volume parenteral formulations are routinely administered intravenously. Tama naman. Solution parenteral formulation may be administered intramuscularly. Pwede rin naman. Tama. Emulsion parenteral formulation may be administered intramuscularly. Yes, pwede rin. And intramuscular administration of parenteral formulation provides a rapid onset. No. Okay. So letter D is false. Baka pag tinanong nyo, bakit akala ko ba pag injection 100? IV dapat, hindi IN. Okay? Di ba intramuscular sa muscle? Which of the following is true with respect to parenteral formulation? So the particle size of the suspended therapeutic agent affects the subsequent onset of action. Okay. False regarding osmotic pressure of parenteral solution, it's A. So a solution which has a molecular concentration of 0.9 is isotonic with blood plasma. So this is wrong. Which is true? So parenteral solution must contain a preservative. Okay? All parenteral solution must be buffered. Hindi naman. Parenteral solutions cannot administered by the intradermal route of administration. Hindi. So it's letter C. Glycerol is frequently chosen as co-solvent for small volume parenteral solution. Okay. '85. Which of the following is true regarding the use of surface active agents in parenteral formulation? Is letter D. Okay, lecithin is commonly used to stabilize emulsions designed for parenteral administration. Concerning water for injections, which of the following is true? So it has defined limits, okay, on the total amount of dissolved solid. So always remember that water for injection is pyrogen-free. What do you mean by pyrogen-free? Free from fever-causing microorganisms. Diba? So, pyrogens ay mga gram-negative. Okay? 87. Which of the following is true regarding oily solution parenterals? Is letter Hello? Hello? Naririnig niyo ako? Hello? Nawalan kami ng internet. Naririnig niyo na ako?
Yes po. Yes po, sir.
Okay. Magtatawag ako saglit ha. Ano lang, check lang natin kung nandito si Posadas.
Sir, present po.
Nandito ba si... Nakikita ko lang yung surname ha. Di ko alam kung girl or boy. Posadas, nandito ba? Ayun, si Liz Christopher. Yung pa. Ay, andito ko. Nandito ako. Sir, nandiyan ka pa? Aubrey, nandito ako. Bakit? Aubrey, nawalan lang kami ng internet. Naririnig niyo ba ako? Hello?
Yes po.
Bakit tinatanong ako nito? Hoy, Aubrey, bakit? Sorry sir, nawala ka sir, saglit. Sorry. Okay lang. Nawalan kami ng internet. Okay, wait lang ha. Inaayos ko lang yung sharing. Okay. 88. Tapos na ba tayo nito? 88, no? 89. Which of the following statements is false regarding ocular dosage form? Letter D. Ocular dosage forms may be used to deliver therapeutic agents systemically. Okay. 90. Which of the following statements is false regarding nasal? So, pwede ba ang nasal systemically? No. So, locally lang kapag nasal. So, letter D is wrong. Okay. For nasal dosage. Which of the following statements is true concerning ocular dosage forms? It's letter B. Okay. Elimination of eye drop formulations from the eye principally occurs via blinking and drainage into lacrimal duct. 92. Which of the following statements is false regarding the cornea, conjunctiva, and lacrimal fluid? So their permeability, okay, to the diffusion of therapeutic agents similar to the cornea. Okay. So yan yung mali, ha? Yan yung mali. Okay? '93. The following statements concern important factors when developing medicines for use in the eye, which is true, letter B. 93, letter B. 94. Absorption of drugs following administration, which of the following is false? Is letter D. Okay. So dapat is less than. The rate of the drug absorption from ointment formulation is less than from eye drop formulation. Okay. 95. Which of the following statements is true concerning viscosity modifiers for eye drop formulation? Is letter C. The incorporation ng viscosity modifying agents may adversely affect the efficacy of preservatives. Right? 96. Concerning the use of preservatives in the eye drop formulation, which of the following statements is false? It's letter B. Okay. 97. With respect to the formulation of ophthalmic ointment, which of the following is true? Letter A. Okay. So therapeutic agent must be dissolved in the ophthalmic ointment formulation. 98. With respect to the formulation of nasal dosage form, alin dyan ang false? It's letter D. Okay. So the pH of nasal formulation is typically alkaline, which is false. So weakly acidic to neutral dapat ang nasal formulation. 99. Regarding suppositories, alin daw dyan ang true? A. Sige, lakasan nyo. Ayun. Para may ambag daw sila. Okay, letter A. Okay. 100. Regarding pessaries, which of the following statement is false? Is letter C. Okay, pessaries. Ano ba yung mga pessaries? Pessary is a type of suppository. Ano? Ano daw? Suppository para sa babae. Okay? So, ba't uwi ka na? Ano? Ronnie? Okay, so let's have a lunch break. So, balik kayo dito ng 12:40, 12:50, kahit 12:50. Ha? Eh, 1 din naman mag-start eh. Di ba? Eh, kasi pag sinabi kong 1 send kayo dadating. So, 12:50 para 1 o'clock start. Okay? Happy lunch, guys. Happy lunch. Sa mga nasa Zoom, happy lunch, happy Sunday.